PASOs works in two main areas. We have our community-based services where we're working with Latino families, but then we also work with organizations and systems in South Carolina. One of the things that we do is cultural competence trainings, and in the last 3 years I think we've done about 130 that have reached almost 3,000 professionals. So the other side of our work is working with organizations to provide technical assistance and consulting to help organizations really build up their infrastructure and have the bilingual staff that they need, develop the policies and procedures that they need so that they can actually provide effective, high-quality services to Latino families.
Another part of the training, that competency training, is really tailored towards how do we have a better understanding and be more cognizant of how we're working with these families, and making sure that we have really a good cultural sense of where families are, but at the same time how we are looking to get in with these families and on a continuum. It's been a tremendous help. They have really helped our sites thrive in looking at referral bases for reaching out to that Latino community. They have helped us with strategic planning around home visiting in an advisory capacity, but they have also helped steer some self-assessments for those local agencies to look at where they are and where they need to be, to build their capacity on their service array, and it has just been tremendous in helping our communities thrive.
We're helping to develop Latino community leaders that have a lot to offer our state, and so we're helping to give that opportunity and bolster them and support their skills and their education. Community health workers are people from the community that you're trying to reach or that have an unusually close relationship and understanding of the community you're wanting to serve. So in PASOs, our community health workers, or our promotores, are people, the majority of which are immigrants themselves. All of our community health worker teams speak Spanish, so they can very quickly talk to people in their language. They also share a cultural identity. Because of that shared language and culture and their qualities of compassion and understanding and motivational interviewing, etc., they are able to quickly develop trust and go further in serving the Latino communities and the families that we serve.
By having the Latino community health worker, it has really bridged the gap that we had. It's really increased the trust that we have within our patient population. I think it's also increased the, just the level of compliance. It's not just a doctor saying, hey, you need to eat less of the sugar foods. It's, why and how can we help the family using their own cultural attributes. She also then will go in with the patients if we want to work with a certain diagnosis to establish trust and some and to do follow-up with them. So she really touches a lot of people in a lot of different ways, but helps our office.
The way I see PASOs as far as from an advocacy standpoint is that they need to, again, continue to be a primary source of information from the Hispanic community to understand what concerns, what challenges they're facing, what needs they have, and then in the other direction, be a voice on behalf of that growing population for others to understand. Decision makers, policy makers understand the importance of the Hispanic community in our state, both from an economic standpoint, from an improving health standpoint, from an educational standpoint, as well as how we could work together to best support that community as it continues to grow across South Carolina.
PASOS has been able to connect the community directly with our systems of care. The Latino population may not have as strong of a voice as we have, so we don't go in a situation speaking for the community, but we want the community to be heard for themselves.
And now we get approached all the time by organizations who are saying, you know, we're not doing this as well as we want to. We'd like to do better. Can you help us? And so that's been a really exciting progress to see. We still have a lot to do in South Carolina, but even just seeing the interest and seeing people recognize the need, I think is a big step. In the future, we would love to see a state that does not need PASOs, that really just has the organizations in place that are already able to work with Latino families effectively. But for right now, one of the things that I think is really exciting is that we're having more and more conversations with organizations about how they work with Latino families.